just going to take a moment and make sure that we're live on YouTube. Sometimes it takes a moment to update. And forgive me, my voice is a little scratchy today.
No worries.
All right, perfect. So it looks like we're live. And
Great.
I'm just going to refresh one more time to see if we're streaming it. Oh, turns out I'm on the wrong. Thanks to everyone for holding on one sec while I make sure I'm on the right YouTube link so I can see the live streamed questions, and we'll jump right in. And Dr. Britto, we had so many wonderful questions for you. So everyone was really excited for you to be able to share your time with us today. So, oh, here we go. It is live. Okay, great. Thank you all for waiting for that moment while I got us set up on the live stream. And here we go. I think it's up. Sorry for them taking a moment. It's usually I can see the streaming. Oh, okay. Perfect. Okay, we're up. Thank you so much. Yes, so and let me just go ahead and mute this. Perfect. Okay, we're up. Thank you so much. Yes. Okay, wonderful. So we're delighted today to be welcomed, be joined by Dr. Pia Britto. And we have tons of questions from both those of you who've posted online in the discussion forums, as well as those who are able to join us in the live chat today. So we can just jump right in. So yeah, tons of questions, and everyone is really excited to have Pia with us today. So this is a question from Kritika, who's in India, who asks, how is it different to formulate and implement policies at a global level with UNICEF as compared to a national level? Can you talk a little bit about the steps that UNICEF takes to ensure effective implementation across different ratifying nations? So can you talk just a little bit about the smaller nations and the bigger nations and some of the implementation policies that to navigate between global and kind of national levels?
Great, thanks for that question. I think that so there's probably a couple of differences to make. So the first is at the global level, the types of policies that are created have to have an emphasis that they are applicable across the 190 countries of the world. So the manner in which they are articulated, the aspirations around them are slightly different from when we talk about a very specific national policy that is set in response to changing a certain situation for children. So the rationale and purpose would be different. Within that, I'm going to pick two very specific examples to demonstrate the difference, both in the setting up of the policy and then in the implementation of it. And I hope that'll be helpful. So at the global level, I'm going to talk about the Sustainable Development Goals as a broad development policy, and specifically looking at early childhood and where does that fit in the global articulation. And then at the national level, I'm going to talk about a national policy on early childhood that could either be articulated in the form of an integrated early childhood development policy, or then a specific policy that looks at expansion of care and education. And I don't know, like the India policy, national policy on care and education. Kritika, I'm just assuming you are from India, but maybe you're not. So the global policy, let's start with that. Really, what is very key for global level policies is a few elements. First, to have the evidence evidence clear, because the decisions that are made based on that are very high stakes decisions, because you are impacting sort of the world population of children. So you need to have the very clear evidence arguments as to why the whole world community should invest in that policy in order to shift the dial or change the situation of children towards the world that we want. The second is, once you have the evidence clear, you need to bring the right set of partners who all believe and understand that this is the policy that really advances the agenda. And I think that in order to make that happen, you need to bring the right partners together. The partners so that is a negotiation and a dialogue where you have the experts, you have the partners, and there is a conversation around, is this really the evidence that is speaking to the change we want? So for 4.2.1, which was the early childhood goal, it was the neuroscience evidence that spoke very eloquently to the fact that the situation of children was that more children in the world were surviving. That's what the MDGs had achieved. And the question was, if they are surviving, are they thriving? So there was a whole set of partners who said, oh my gosh, this is not the case. We have the Lancet papers. We really have to do something about bringing the brain science forward. But then there was a whole set of partners who said, well, actually, the SDGs are more than just about children. It's about sustainable development. So where's the evidence that shows that actually by making this, not only are we helping children, but also communities and societies? So then you bring your partners together in the dialogue. And then the third stage is the negotiation, to really articulate the vision and the explicit change we want to see. And that also happens through a process of consultations, getting countries involved in the conversation, a range of implementing partners, UN partners, private sector, and you sort of then go towards the final articulation. So that's the policy making process, the implementation of which rests then in across a lot of bodies. And that's where coordination is a very key function in the implementation of global policies, because the actualization of it isn't just one agency or one partner or one government. It rests across a lot of different actors, and each one of them bears some responsibility for the implementation. So for 4.2.1, there are partners who are engaged in the implementation of it, those in the monitoring and reporting, those in the funding and finance, those in sort of bringing the political visibility and weight and direction to it. So you see there are many ways, and this coordination has to occur so we know that we are taking the right steps to accelerate and make change happen. Now, nationally, it's kind of similar but also different. So nationally, the policies are set in response to a very clear situation that says, this is the set of risks that are facing children in our country. And because of these set of risks, these are the outcomes we are seeing. So we need to set a policy that addresses those risks in a manner that we change the outcome. So let's just say the set of risks facing children is that there is insufficient health services, inadequate nutrition, and great exposure to let's say great exposure to let's say experiencing of poverty. So then you want to set a policy in place that says, how are we going to expand quality, accessible health services that have basic health services, early stimulation and care? How are we going to ensure that nutrition counseling, nutrition commodities, and early stimulation is provided to families? So strengthening of the delivery systems. Plus, what kind of support grants or social insurance mechanisms can be put in place that help mitigate poverty? So if we look at a national policy and program such as Chile Crece Contigo, which has been running since 2007, we see in place these core elements that were put in place to really reduce vulnerability, improve outcomes for children, and really make a strong result. And I think that that the implementation of that then rests in certain line ministries, certain implementing partners, and local governance, where the accountabilities are designed in a manner that they have certain budget accountabilities to the beneficiaries, and then to the monitoring and change in results. So we see a different set of actors. Just overall for early childhood, you always need coordination because it's such a multifaceted set of inputs that go into improving child outcomes.
That was a fantastic overview. You touched upon this a bit, but it was brought up several times in the discussion forum. So, for example, Denise brought up the idea of a kind of using evidence-based programs across and with the intent to replicate across multiple different contexts and cultures, and that sometimes that can actually impede innovation because there's this idea that one bit of research or evidence-based practice should work for all. So you touched upon this a bit in having local actors, but can you talk a little bit more about kind of the flexibility in how evidence-based research policy and practices should be implemented across different contexts?
Yeah. So I think that here, so I think we use this word evidence in to maybe mean different things. And there's one, and I probably want to clarify this a bit here. The first is that the way I'm going to use evidence is I'm going to contrast it against opinion. So I'm using the word evidence now in describing what you have asked, to say that whatever decisions are made with respect to programming are not opinion based, but they are informed by data, by information, by sort of understanding the situation on the ground. So there are many sources of information that go to form this evidence as opposed to opinion based. So that's just sort of one very, very high level differentiation I'd like to make. The second differentiation I'd like to make is that for certain types of programs, the evidence about the ingredients of the program are pretty clear. So we know that certain immunization doses have certain key ingredients. They are irrefutable. You need those amounts of those key ingredients or that dosage to really make the difference. What differs is the delivery mechanism and how that delivery mechanism is contextualized to the context in which you're working. Okay? That's for the more very specific types of interventions. So, if you are delivering immunization in a very well functioning health system, for example, you know exactly the points of contact, the routine immunizations, the health clinics, the trained professionals. So, that delivery would be very different from if you are delivering the same immunization, that same set of ingredients, in a context that there is a very weak system for delivery. You would then bring in very different innovative approaches in the delivery in terms of still reaching the children with that ingredient, effective ingredient. The second set of interventions is where you do not have such a defined set of key ingredients. It's more broadly outlined. And here I would turn to community-based childcare, for example. So for community-based childcare, we don't have such prescribed set of core ingredients. We do know the basic environments, how you enrich them for children. We know the safety and security. We know the hygiene and support. We know what's required for training of teachers. But the articulation of that would vary greatly whether I was in a community in East Africa, in Uganda, or if I was in a community in Timor-Leste, in the scattered areas. So I think it would be quite an open set of quite an open set of the way those ingredients would come together in order to deliver the program. In this second category, what we need to keep in mind are four elements. We need to keep in mind the dose, that's actually going to make a difference. The delivery, how is it going to be delivered? Who is delivering it? The demand, what is the demand for this? Is this actually happening? And how do you monitor the results and know you're making a change? Those four elements are really important. Again, it's an evidence-based program. We know children after a certain age benefit from being in other groups of children where they get enrichment and learning. So you're still going with an evidence-based overall model. But these are the four elements of characteristics that help you define your program. And then the final piece on how you use evidence is How do you embed your intervention within the existing system? So a lot of these are not just standalone interventions. So it's not just that you design your program and you say this is how I'm going to use innovation or evidence to make it happen. It'll never go to scale. In order for it to go to scale, you have to understand what is the system in place. Is it that you're going to have in order to reach all families? So let's just say we want to support parents because we know that bonding, attachment, caregiving, good sort of nutrition and hygiene is key for children. So now, in order to reach all parents, we have to say, what are the systems in place that reach all parents? So in many countries in Latin America, there are two systems that reach all parents, the health and the social protection through some sort of cash transfer. So then your focus is in those two systems. What do I strengthen? Do I strengthen the counseling skills of the frontline workers to be able to relate to the fathers and mothers, to give them this sort of counseling on how they do early stimulation, care, and nutrition? Do I strengthen the system by having a very strong curricula for these frontline workers? You sort of decide then how are you going to use your evidence base in order to know how do you embed it in the system. So evidence is used quite differently depending on what is the aim you want to achieve, the context in which you're operating, and how prescribed is your evidence for a specific intervention.
What a fantastic answer. You've touched upon so many questions that have popped up about implementation and feasibility and dosage on the discussion forum. So that was fantastic. Thank you so much. Just to touch a little bit more on measurement, can you talk a little bit more about the different types of measures that you use across different contexts to assess things such as dosage, or even just more broadly about how you approach measurement?
Yes, thanks for that. And I think that this is an area where we really can do much, much better. And I think in the field of early childhood, we really need to think about this some more. So, so first, I think in terms of measurement, we can look at it at a couple of different levels. We look at it at the impact we want to achieve, the outcomes we have in mind. So the outcome could be what children should know and be able to do at a certain age. What are the outputs we are hoping to get at? How many parents receive a service? How many children receive a service, sort of thing? And then what are the inputs we put into that? What kind of training do we provide? What is a curricular practices? All of that. So that's one way to just set a basic framework. But then within that basic framework, then we need to think, in order to really get the results right, we have to cover a few dimensions. We have to cover dimensions of the coverage of the service. So, what percentage of newborn babies and caregivers receive counseling with early stimulation? What is the gross enrollment rate for early learning pre-primary education? That's a coverage of service type of indicator that needs to be part of a national data system, typically a health management information system or an education management information system. The second type of data within this framework that's important to get is, what is the capacity for delivery? And I've been using this word capacity a lot because for early childhood development, it's not a commodity driven service. It's actually a service that relies very much on human interaction. And it's really the engagement between the parent and child, between the caregiver and the mother, between community groups that makes a difference in attitude, knowledge, and behavior. Because those are the three elements that bring change for child outcomes. So the second sort of data we need to look at here is, how are we monitoring how many frontline workers are trained and certified? What does the certification look like? Is this certification part of a national training system or not? The third set we have to look at is this service being scaled up? Is it remaining stagnant in just a few areas, or is it expanding beyond those areas? Number of districts that take this forward, number of registered child community centers, is there an increase in that? And then finally, we look at these sort of child outcomes where we want to look at child health, child development, child well-being, maternal health, parental health, well-being. And here we sort of look at the population level measures to see the change we are having. So I think that the measurement of our work enables us, and here I haven't talked about policy implementation at all. I've really stayed at a program services level and a child outcome level. I haven't really talked about the policy level of measurement, where we look at how budgets are allocated, how budgets are monitored, the governance of the policy. I haven't sort of looked at any of that, but really talked more at just delivery of services and change in child and family outcomes.
Thank you so much. And I didn't mention this, but that question came from Hassal from the discussion forum. So thank you for that question. So I'm going to, there's kind of two levels of questions that talk about providing early childhood education and services at two different vulnerable communities. So Anna and Buban both had questions about how to support those children and people who live in refugee camps who have very uncertain futures and are kind of stuck in limbo. So can you talk a little bit more about how to support children in refugee camps? And then a question that you can build on is also from who's on our live chat, which is, so focusing specifically on the most vulnerable populations, which would be refugee camps, and then how do we apply these kind of ingredients to children more broadly in lower and middle income countries?
Okay, so I'm going to take the children in fragile context, children on the move question first. I think that just in general, the response to children on the move, either migration, refugee camps, children affected by conflict, typically putting in services that promote children's development is sort of always a second thought. The primary thought is around survival and safety. And so just the inclusion of getting in psychosocial services, getting in what parents need for parenting, what young children need to sort of find stability in their life in this turbulence, sort of always comes secondary. And this is something that there are a great many number of groups who are trying to address and who are trying to change that. And it's really good to see that space where these innovations are occurring. I think most everyone on the group might be familiar with the work that Sesame and IRC are doing, for example, to bring innovative programming to refugee camps in several countries in the Middle East, where they're trying to combine sort of in-person service delivery with technology to sort of break through some of the challenges of weak and disenfranchised and sort of broken down systems. So that's one set of innovation that is going forward. A second set of innovation that is going forward is trying to create safe spaces in these communities, in these refugee camps that allow children to be children, that allow parents to have that time to be able to take care of them, that in migration situations allow them to maintain that thread of family life, sort of not losing that fabric and keeping that together. And there we have been trying to introduce certain types of interventions, like we have a kit, a box of toys, because play is one way to bring normalcy to children's lives. So sort of using that box of toys in many different ways that allows children that space to sort of still be creative, still learn, still engage with the adults in their life, and then sort of caring for the caregiver. So providing services for the caregiver where they are not just taken into consideration as the parent, but they themselves needing the support to feel healthy, to feel well, to care for their children. I would say a lot of this work is still very much in the early stages. If you do sort of literature reviews for robust evaluations and data, it's all still coming through. We don't have very well-defined packages or very well-defined clear recommendations on dosage, on ingredients right now. We're still working through it. But I would say the current efforts that are underway are really good. And I would recommend and really encourage those who are on this call to maybe look at these as some of areas to pick up for career development, for future sort of going forward with your work, because we know that these are situations that are facing children. We need more smart, young, bright people to get into this, to really design what programs could look like, what services could look like, to try and normalize and make better lives for these children that are facing this kind of adversity.
That's perfect. And then the second question was about how do we take all of the ingredients that you talked about to broadly capture as many young children as possible in low and middle income countries. So sometimes a lot of focus goes on very vulnerable communities. Can you just talk a little bit more about how to kind of try and capture as many kids as possible in low and middle income countries?
So I would say you have to do 3 steps to make that happen. The first step is, I think you really have to do a very careful analysis of the most immediate, the underlying, and the structural causes that are causing this deprivation, or that are causing kids not to sort of achieve their potential, and sort of creating these intergenerational cycles of disadvantage. And this has to be a pretty careful analysis within the country context, looking at whatever available data there may be, and or sort of doing a good thorough review of what is it that's holding it back, because each of these causes would have very different responses in terms of the intervention you put in place. I mean, maybe the immediate cause is the kids have inadequate the parents don't have enough time to be with their kids, so maybe a response to that would be quite different from if the underlying cause is that basically the environment around the child is unsafe, and the kids live in sort of unhygienic situations, or some combination, or a very macro cause where maybe the issue is air pollution, and that's sort of the dominant. So the intervention would have a very different range. The second is, in order to really reach kids, especially the most disadvantaged, we need to shift our focus a little bit from the intervention to the implementation strategy. And here is where I differentiate a bit. So the intervention is the service you provide. So the service could be a parenting program. The service could be sort of a book club, or whatever the service is. But how do you implement it? Those implementation strategies are the key to scaling up and to reaching the maximum number of children. The first implementation strategy for early childhood is, what kind of multi-sectoral mechanism exists that enables these services to come together, because single sector solutions do not achieve the full result you need. The second is, how do you strengthen the system to deliver the service? And by this, I mean, you don't just keep overloading the system with more and more interventions. That's not system strengthening, that's overloading the system. It's what do you put into the system that is going to deliver the outcome for you? And it doesn't mean you're going to put into the system my favorite intervention. It means thinking through, what does that system need to have to deliver for me the outcomes? So if the system is community-based delivery of nutrition and childcare, what do I need to make to add to that system? Is it monitoring? Is that what's going to strengthen the system and enable me to have the outcomes? That requires a careful analysis. The third is really promoting a demand for the services and social norms towards sort of this understanding of the importance of why parenting, caregiving, stimulation matters. Oftentimes all our strategies are supply side strategies, and we don't look at demand side strategies. So in order to reach vulnerable populations, understand their needs, why are they excluded, the demand side strategies of social accountability, of sort of harnessing what parents want, is really important. The fourth is understanding the role of advocacy and communication. And here it's really understanding the strategy of how do you communicate to your audiences, knowing you have many audiences, because communication is key. Just explaining sometimes the why is enough, and then parents know what they need to do for the how. Just explaining to them why talking to their children matters is key, and after they'll figure out the how. You don't have to go with the how and say 10 minutes read the book, 5 minutes talk to your child, another 10 minutes spend, say, 300 words. You don't need to say that. Maybe all you need to say is why talking to your children matters, and pitching your advocacy to the right influencers. This is a really important strategy for reaching everyone, to get the decision makers with the evidence and the advocacy strategy that is going to speak to them. And recently we have seen that in the G20, where we were able to advocate to the governments for the importance of early childhood, and had the world's 20th largest economies now understand the importance of this, and at the end of this month sign the communique that early childhood matters for fair and sustainable societies. The next strategy is really using data well. And here, oftentimes, just collecting the data or having it in the system is insufficient. It's analyzing it to be able to make change. And oftentimes, we stop at either creating the tool where we say, okay, we have the indicator, or we stop at putting that indicator in the administrative system and collecting the annual report. And we don't take it to the next step, which is saying, after we get that data, how have we used it to improve or make a change? And the last strategy to scale up is strengthening public finance. Really, in order to get this to be a core service for all children, the public finance for it has to be strong. And it could either start with, initial catalytic funding that comes through sort of aid modalities, and then governments are incentivized to increase their own funding, or finding a way to create space in the public finance planning and budgeting process that brings these services together. So these are the core strategies that really, really take this forward. And then within that, differentiating it depending on the country context you're working in. Because saying high, low, middle income is just an income stratification. It really doesn't give you a sense of inequity in the country, capacity and conditions in the country. So then you have to differentiate the countries. Is it emergency? Is it fragility? Is it low capacity and conditions? Is it got medium capacity to deliver, but the conditions are rocky, sort of making that differentiation that enables you then to know which strategy you're going to lead with. Are you going to lead with a multi-sectoral strategy? Are you going to lead with a public finance strategy? Sort of what is the first strategy you're going to take forward to make that delivery happen? Sorry, I'm giving very long answers.
No, these are absolutely fantastic answers. And I think that you're touching on so many different facets to the questions, which is really wonderful, because I know that our students have thought very deeply about how to actually implement ECD and ECE in ways that take culture and context and systems into consideration. So I think those types of answers you're giving are very enriching, which is wonderful. Just a quick follow-up from Kritika from our live chat that touches upon one of your earlier questions, which is specifically, how does UNICEF incorporate innovation done by different countries in around early childhood development? And so are there ways in which learning from smaller nation programs can inform how we advise larger nation programs? Or could you talk a little bit about how different programming across different countries can be incorporated to develop new programming, for example?
Yeah, we have a mechanism. We have two mechanisms in UNICEF to sort of foster that. One is called sort of South-South cooperation. And here in South-South cooperation, we look at countries which have similar implementation contexts. They may be in very different regions, like small island states from East Asia compared to small island states in West and Central Africa, for example. And we would facilitate South-South cooperation across these countries on key elements that may be common to the question that they are asking. Is it a way to monitor child outcomes? Is it a way to strengthen their information system? Is it a way to reach communities that are hard to reach? Or so we foster that through a South-South exchange, and we try and make that South-South exchange happen in a manner that we can really make it relevant. So you don't want to sit in a South-South exchange where your implementation context is just completely different. The way your government works, the key partners who are delivering the service are completely different. It's not relevant. The second is we try and really support think tanks and networks that are keen on knowledge exchange. For example, ECTAN, the Early Childhood Development Action Network globally, ARNEC, which is in the East Asia Pacific region, ESA, which is Step by Step, which is in Eastern Europe. We try and strengthen these hubs that are sort of collecting this knowledge information, whether it be on best practices to improve capacity of the workforce or best practices in curricula. We try and strengthen them as a way to be that sort of knowledge hub and share that information on innovation that is ongoing. And we do this with other partners. So the recently launched Nurturing Care Framework, for example, with WHO, we have launched an innovation strategy survey to collect data and information on, what are innovations, how are they working, how can we take them forward, and then a way to share that. And then we actually have an innovations unit that also does a lot of what innovation tools have worked in one or two countries and are strong. They sort of take them then and shop them around and see if there is a need for it in other countries, like very specific real-time monitoring. So, what real-time monitoring tools have worked in certain types of rural contexts? Can we take them to other rural contexts? So that's very much around an innovation product. So those are the ways in which we try and support knowledge exchange and learning. Our country teams come together quite often within regions as well. So we have regional sort of network meetings in Middle East and North Africa. We had one recently where the countries wanted to learn about the Care for Child Development package. So 7 or 8 countries came together. They want to learn how can they implement the package, what would this mean for their services. So it was sort of organized learning around that. And a sharing of how they might take it forward. So that's another modality we use within UNICEF to foster that learning and exchange.
That's fantastic. We had a couple different questions. So Anna from Argentina, Carolina from Brazil, and Beverly were all interested in kind of how students who are taking this course could help UNICEF develop better interventions or programming in their local communities. And so what are some ways that you might advise students who are taking this course and listening to you to get involved and support UNICEF or early childhood development more broadly?
I would say definitely reach out to your local UNICEF office. Let them know you're available. We offer internships and we offer opportunities for participating. And this would be something you could definitely join. I know we always welcome young, smart, talented, passionate people. I always have them on my team because that's how we get new ideas and we feel like we are supporting the next generation of leaders in the area. So definitely contact your local UNICEF office and also your other implementing partners who are really working on something. Bring your ideas to the forefront on that as a way to get engaged in the delivery of the program.
This is a broad question from Lawrence on our live chat, who asks, kind of, if you could have gone back and done something differently in the field of ECD by a decade or so, is there something that you would have wanted to change in early childhood development implementation if you could go back in time?
That's a really good question. I'm really glad you asked that. I think if I could go back in time a decade, I would have tried to really work on changing or finding an easier way to communicate the problem statement. Currently, we don't have a very clear way to communicate the problem statement that children are not developing on track. It's a very technical, jargony statement. It's not easy to see, like children who are stunted and those who are not. It's not easy to communicate, and I think if I had to turn back the clock, that would have been a priority. How do you communicate this problem situation that children's brains are not healthy, they are not developing the way they could, and this is preventable? And a way to measure that and communicate that, because I think that most initiatives, when we see big change happen, it's driven by a very clear articulation of the problem statement, and that then brings the activism and the advocacy behind it, and that sort of then creates the movement. And typically telling a positive story doesn't generate the same amount of response. And so I think that that would be something that would really help. I think, and it's not too late. I still think that we have to crack the nut on what is our problem statement. We know it in the technical language. We know what it means, but we cannot cannot communicate it to lay audiences. And I felt this so acutely when I was in the G20 conversations with different sort of government representatives from ministries of foreign trade, from aid, from a multilateral relationships, who are not in this field, but they want to make change. And how do you communicate to them without sort of getting them lost in the technicalities of it, that what is at stake and what should matter. And I think that this would be very powerful in really building a scale-up movement for young children.
Thank you so much. Another question from our online chat comes from Barbara, who's very interested in the nutritional aspect of early childhood development and was wondering if you could speak a little bit more about nutrition aspects of early childhood development, and is specifically interested in breastfeeding.
And when you say you're interested, I'm not sure. You're interested in the science of how breastfeeding contributes?
Maybe on the programming of how we...
Okay.
Yeah.
So I think that there are sort of three elements to the programming that at UNICEF we are trying to bring forward. The first is the actual practice of breastfeeding and the skill of breastfeeding, and this is sort of starting at birth in delivery rooms, that we start this intervention and promote it in the work that we do. The second is the attitudes and approaches towards breastfeeding that comes from the broader community, that comes from sort of this communication for behavior change, behavioral insights, sort of that's a broader messaging and advocacy. And then the third is around actually giving space to mothers to breastfeed, allowing them the time. And that's from really advocating with businesses and government partners that mothers should have paid remunerated breastfeeding breaks for the first 6 months. So there are three levels at which we are operating to strengthen these interventions, so as to be able to achieve the outcomes we want. I think oftentimes we are also faced with having to sort of combat a lot of messages that are in the marketplace about formula foods that are sold and marketed in a manner that they seem appealing to families. They seem like if you're paying for food, it must be better than breast milk. The second is on maternal nutrition, really reinforcing the importance of maternal nutrition as a key area. So, when we're looking at breastfeeding, we're also looking at the mother's health, the mother's well-being, and then sort of finally sort of using that and the broader linkages of that to say that the messaging around breastfeeding is not just for child survival, but also for child development.
Thank you so much. A couple questions. So from Rhonda in Canada, and Hannah touched upon kind of the capacity for ECD and kind of issue of implementing programming without having enough teachers, for example. So class sizes getting very large. Can you talk a little bit about some of the issues you found in finding educators who are then able to help implement some of these programmings, and how to kind of recruit and get more early childhood educators into the field?
First, I want to say all your questions that the students have had have been incredible, and I really, really enjoyed talking about them. And I know we're not done, but I just had to say it because it was my spontaneous reaction. And B, the depth of understanding that these questions demonstrate is really impressive. So my congratulations to all the students. These are really, really good questions. I do want to pick on this question of capacity. I think it's a very key one that we have to address, because the capacity is there are two types of capacity that are lacking: capacity of delivery and capacity of knowledge. These are two different capacities, but both of them impinge on the ability to reach young children and families. Capacity of delivery is the first one you talked about. Do we have sufficient trained early educators? Do we have sufficient trained counselors, nutrition counselors, health counselors? The answer is no, we do not. We do not have sufficiently trained service providers in this field for several reasons, and this is a global shortfall. We don't have this for several reasons because A, it's an underpaid profession. If you look at salaries of preschool teachers compared to third grade teachers or middle school teachers, you'll see a big differential. So people do not want to go into the underpaid layer. The second is the accreditation standards for most of these professions is not well articulated. So you do not know the quality of people coming in. And third, the curricula and training materials are not as clearly developed by ministries and governments and training institutions as they are for other areas of getting credentialing to be a nurse or to be a doctor or to be a primary school teacher. So at the capacity for delivery, we have several very big challenges that we have not been able to address. There's not sufficient funds go towards it. It is not considered a high level enough profession for people to be interested and take it on. And the actual curricular materials are lacking. And I think each of these three presents a significant bottleneck that needs to be unlocked and addressed. The second area where we have a limitation is capacity of knowledge. Capacity of knowledge relates to the managers, the program designers, and the policymakers. They don't actually deliver the service. So they are not the teacher in the classroom, but they need to make the right decision if they are the school principal, or if they are the district level officer, or if they are designing a program for an NGO or an implementing agency. They have to make the right decisions on the, do they have the adequate budgets? Are they focusing on the right elements? Are they just focusing on building the classroom or what goes into the classroom? Are they focusing on just providing nice, shiny posters or actually the time in the curricula that enables a teacher to engage with the child? And this capacity of knowledge is a very, very big gap. Because the moment we talk to people about early childhood around the world, they say, we're delivering water and sanitation. We are delivering food. We're delivering immunization. So the kids are good. And then we say, no, but what about the parenting? What about, all these other elements? And most folks don't have that knowledge. So if we look at some very interesting programs and where they start to train local mayors, for example, in what is it that they need to provide, or even community level. I know in Cambodia, there was a lot of training done of the Sangat committee chiefs there to be able to understand what are the key elements of early childhood they need to have so their community, the children in their community can thrive, is the capacity of knowledge gap. And both these are sorely lacking. It's like early childhood is like a boutique area of learning and knowledge. It's not mainstream. Most people don't know about it. It's sort of this very boutique-y thing on the side. And until we get it more mainstream in these two capacities, we are not going to be able to get the results we need.
Thank you so much. Husna on the live chat, I hope I said that correctly, brought up a really interesting point. They brought it up in the context of countries and views on child labor and how it still exists in some countries, and kind of how child labor and ECD are how do you kind of implement ECD in context where the child either labors to work to provide for their family, or kind of how we can change the thoughts about the importance of ECD in countries where there is child labor. And I think an umbrella over that, specific to child labor, but also kind of that there are many countries in which children are providing kind of economic support to the family by working. Can you talk a little bit more about how we bring ECD into those countries and how we do so in a way that's thoughtful to the economic needs of the family and the cultural considerations?
Yeah, no, thanks for this. And I think that this is a really important area to touch upon. There are a couple of ways in which we are looking at this impact of sort of child labor, and what is it that we can do to change the paradigm around this. The first is that we really are trying to improve access to primary school, because once we get children in primary school in quality learning with the incentives, there's a greater chance that parents will send them, and alongside that provide childcare. And there's been some interesting work that has come out of the World Bank a few years ago, where in Eastern and Southern Africa, they looked at these models where if you provide childcare centers, then the older sibling sister is more likely then to go to school, and the school sort of provides the support they need. And if that childcare is also a form of sort of micro enterprise for the mother, then you see that you're able to help the sort of two generations in this. So that's one set of work that is coming out. The second set of work coming out from places like India is sort of the mobile creche program, where again that program tries to take care of children in a manner that they are in the enriched environment, and at the same time the older sibling sister who typically is engaging in child labor has then the ability to go to school, and the mother has the ability to earn her wages. So there are a couple of initiatives underway. There are not that many that link the issue of child labor and early childhood development so closely, but these are some of the models that are evidence-based that we are seeing. There could be other smaller level models that are operating, but I'm not intimately familiar with them and the impact they have had in making change.
Thank you so much. You touched a lot upon kind of integrated approaches. And so Lawrence, on our live chat, wanted to discuss a little bit more about fully integrated comprehensive programs for early childhood development. So he talks about New Champs, which is, incorporates nutrition and child and maternal health and parenting. And can you talk about kind of the drawbacks of programs that are extremely comprehensive versus kind of more targeted approaches, and how do we navigate across those kind of different implementation strategies for how broad or comprehensive a particular programming is?
Yeah, and I'm glad you use both the words integrated and comprehensive, because I think they're both a little bit different. And I think integrated means you sort of put one integration into another, and comprehensive means you provide all the sets of services in a coordinated manner. What we are finding is getting true integration is actually harder and harder, because there are different sort of ministerial budgets that go into the support of certain services, and it's harder to get ministries and sectors to combine budgets. It's easier to coordinate their actions, so you get a comprehensive set of services delivered that you coordinate and say, in this district. I was in Tajikistan recently, and I was very impressed with the mapping that the government of Tajikistan had done with their aid partners. And they had mapped out in the different districts what were the needs for children and families, which were the aid agencies who were going to provide the financial support, and which were the ministry programs that were operating there. And these were not quite integrated, in that they were not all delivered from the same setting, or they were not all delivered from the same platform, but they were coordinated in a manner that together they comprehensively addressed the needs of the children in that district. And we are seeing more of these comprehensive, coordinated, multi-sectoral approaches as getting to where we need to be for our outcomes. And it's been harder to sort of get the integration per se in place. The places we see the integration in place most commonly is when you need the two interventions together to have a combined effect. So stunting, for example, needs good water and sanitation, hygiene, and it needs good nutrition. So if we look at some of the stunting elimination interventions, we see oftentimes the interventions are combined together, they are integrated together on hygiene and on nutrition to be able to get to that outcome. But we don't, it's harder to get to the integration. It's easier to get to coordinated, comprehensive, multi-sectoral delivery of services.
Thank you so much. One last question I think we'll end with. So this comes from Celeste, and she's in Canada. And so she's really interested in kind of how do we support early childhood education and promote services to migrants who are coming into a country like Canada from other countries that might not have had early childhood education practices as integrated into kind of the culture, the access available to those types of services. So this is a question about kind of when families are arriving into a country like Canada, for example, how do we promote or engage those families to use those services that are available?
Yeah, I think building trust, sort of bringing the acculturation and the cohesion across communities is very, very important. And um, we still are learning in this area on host communities and how they receive the migrant communities who have come in. Um, at this point, we are sort of seeing a few things that have helped. One is when the early childhood centers allow time for drop off, pick up, and some kind of parenting groups and counseling around that, we see that starts to build a lot of trust in communities because as parents drop off, pick up their kids, they manage to have conversations with each other, understand each other. That's one model we're seeing actually coming from several countries that is helpful. The second is actually having groups of parents come together where when they come to a conversation, they cannot talk about politics, they cannot talk about anything, they can only talk about their kids. And in exchanging stories about their children, about parenting, it starts to create a common safe space for bonding. And then through that come up the next level of service questions around services, trusting the system, and being able to deliver. Again, some of these are very initial forays into in the area of early childhood and sort of services that host and building social cohesion with host and incoming communities.
Thank you so much. And I guess since we have one more quick question from Hasna, who is on our live chat, and then we'll let you go. Thank you so much for these fantastic answers. So Hasna is a law student and is planning to major in child rights and is interested in how kind of the role of law and as a lawyer, they can advocate for early childhood development. So do you have any kind of brief thoughts on that and the role of kind of someone like within law contributing to early childhood development?
Yeah, I mean, I think that there are many elements, and I remember when I was at Yale, I had several law students who would actually take up my course because there's a whole area, I think, on understanding the rights of orphan and vulnerable children, in terms of what are their rights, how are they represented, how do we get them out of institutionalized care, how do we get them into family care. The second is on children's birthright, their citizenship, getting their birth registration. There are so many areas of name, identity, of belonging that are basic rights for which we don't have full implementation, and that are very important to just establish the ability for children to access services, to be in rich settings that they don't have the basic right to. I think there is I cannot remember, but there used to be a really good website that had and very interesting updates on the key articles of the Convention on the Rights of the Child, and the right to development, the right to participation, and how those were being implemented by different countries, and what were the needs to sort of strengthen those implementation areas. And I think that that's a key area to take up because we still see very, very, very many gaps in the implementation of the Convention on the Rights of the Child, especially for early childhood and the interpretation of those articles for the youngest children.
What fantastic answers. Thank you so much for your time. You've had just the most wonderful response from our live chat of people thanking you. So I'm so glad that you found the questions to be as interesting as I did. We're very lucky to have some very smart and engaged students in the course. So thank you so much again for joining us.
Thanks, Kat. Thanks so much. Thanks to everyone. Best wishes and continue your good work.
Great. Thanks.
Bye. Bye.